Cervicogenic headache is the term for headaches that are thought to be initiated in your spine, in the neck, which has the name cervical spine. So cervicogenic headache can be anything from the structures in your neck, muscles, joints, discs, nerves. Those structures can radiate pain to your head. There is your brain, which in a sense registers the headache inside of your head. There's your neck, which has got a spinal cord going down to it. Now, it turns out that the nerve which handles the face actually part of it originates down in the spinal cord, such that anything that hurts in your neck and shoulder area can feed into this part of your spinal cord and actually register to your brain as face or behind the eye pain, back of the head headaches, because these nerve pathways all overlap. Cervicogenic headaches can be caused by a lot of things. They can be just something, I hate to say minor, but as minor as muscle tension and muscle tightness. A lot of muscles are attached to the base of the skull and to the neck, and they anchor kind of at the top of the shoulder where your shoulder blade is. So all these muscles, besides having to hold your arm up, they have to hold your neck up. Now you put that situation into a stressful situation or overuse or poor posture, and all these muscles start to get tight and kink up. Those can be painful. They can be called myofascial pain or trigger points. If you have wear and tear on the discs in your neck, the little cushions between the bones, those can make the bones move differently. That can irritate nerves. That can make the back of the spine joints called facet joints push together harder than they're supposed to. And that can lead to some really deep, nauseating, back of the skull kind of pain. A lot of patients will say, I've told my doctor forever, my headache starts when my shoulder blade hurts, where the back of my neck hurts, and then once it gets there, I know it's going to go to the back of my head and then out my eye, and I'll have a big migraine. So they might end up as a migraine, and sometimes the migraine medicines work, but if what seems to be triggering someone's headache is in the shoulder or the neck area, we consider that a cervicogenic headache, and we try to use other methods to interrupt it before it becomes this terrible migraine. So treatments then for the cervicogenic component, as people who have headaches know, there's a lot of medicines used for headaches, because if you have a pure migraine headache, you're inside your skull, you can't really get in there. For your neck, there's physical therapy, chiropractic, acupuncture, steroid injections, mind-body relaxation techniques. So the nice thing about the neck is it's reachable in a lot more ways than anything inside your skull is. A couple things that we have to deal with are gravity, which pretty much make our bodies want to go down, so we use all these structures to hold ourselves up. And I think, as a lot of people know, the weather changes. So we say, look, then you've got to adjust your posture, make the whole issue of the weight of the world, literally the weight of the world off your shoulders, is to pay attention when therapists coach you on posture, relaxation techniques. Sometimes it's medication on a regular basis. I think it's knowing what your own triggers are, and I think acknowledging that you can't just go running to a doctor to have you rescue you when the pain is out of control. You have to kind of start to go backwards and say, okay, what can I do for the most part that can alleviate this? If you're in the middle of a 10 over 10 headache, you can't do it at that point. You need others' help. But when you've got the moments in between, that's when you want to learn, well, what can I do in this area to help myself?